8:22, welcome back in. We know a lot of couples struggle with trying to have a baby just for whatever reason they can't. And here to talk more about that and maybe help somebody out, Dr. Mamie McLean. She's a fertility specialist with the Alabama Fertility Specialists at Brookwood Baptist Medical Center. Thank you for joining us this morning. Really appreciate it.
Thank you.
We know this is going to be very emotional for a lot of couples. You know, they're trying to have a child, and again, for whatever reasons they can't. So talk first of all, if they're thinking about maybe seeing a fertility specialist, who should be a candidate? Who should want to come in and who should be eligible to come in?
Absolutely. So for women over the age of 35, we actually recommend that they come see a fertility specialist after trying to conceive for 6 months.
Okay.
Age is the biggest predictor of success for couples, and therefore we want to make sure that we're moving patients into evaluation and treatment as quickly as possible. For women under the age of 35, after trying to conceive for about a year, that's when we recommend that you come see a fertility specialist.
Okay, and we know just from reading different articles and news stories that we have come a long way in terms of research. So what about the newest advancements in research, and what types of treatments are available?
So for the past 30 years, our field is focused on improving technologies to help more women get pregnant and have babies. Over the past few years, we've started to focus more on making those treatments healthier for mothers and babies. And 3 ways in which we've done that is, first, for couples undergoing in vitro, recommending elective single embryo transfer, or selecting 1 embryo for transfer and then freezing or cryopreserving the additional embryos for future treatments.
Okay.
Secondly, we've started to utilize pre-implantation genetic screening, or actually testing the embryos, see which ones have a normal DNA component and selecting those for transfer. And then lastly, utilizing frozen embryo transfer compared to fresh embryo transfer.
All right, so I'm sure the people hearing that, and they're probably intimidated by all that technology, but if you go see your specialist, obviously they'll be able to alleviate you of some of those concerns and answer those questions. But what about our diets? And we see a lot of supplements too, where people, you know, there's people promoting certain vitamins you can take that will help. Do they help? What kinds might help?
Sure. So in terms of diet and impact on fertility, the data is fairly messy. But for women having regular menstrual cycles, there's no specific diet that's known to improve fertility. For women with irregular menstrual cycles, we know that low carbohydrate, high protein diet can actually improve fertility. And we know, especially for women with a body mass index over 30, we know that diet and exercise to help get their body mass index below 30 can improve fertility.
Okay. So there's no magic vitamin that you can take, right?
No, but to answer your question about vitamins, for women trying to become pregnant, it's important that you take a prenatal vitamin for up to 3 months before trying to become pregnant. Okay. And it's actually that folic acid component of that vitamin that's most important.
Okay. You know, if you go through a lot of fertility treatments, some people might wonder, what's this going to do to my body? So what are the risks that are involved with that?
So certainly there are impacts of the hormonal fluctuations on women's health. And we know that long-term fertility treatment potentially can increase a woman's risk of cancer. However, that data is also fairly messy because of the impact of infertility on cancer risk. Short-term fertility treatments don't have any particular risk for women. Okay.
Well, doctor, we appreciate some good information there. Hope it helps a lot of couples out there, and see your fertility specialist. It might help you out.
Yeah.
Hope so. Thank you.
Thank you.
All right, JJ is standing by.